Dr. Emmett Emery Sr. You Better Stand Your Watch podcast. Well, this actually is the first podcast in the new year 2026. So much got done and so much time was utilized in the year 2025 that I thank the Lord for. And to get me to the point that I am now in the mental health profession. With that said, I'd like to start this off by thanking certain individuals who have gone above and beyond to help me thus far. Because the toughest thing for individuals to do is to teach you their profession. And the toughest thing for an individual to be able to do is understand another profession after being 34, 35 years strictly into one profession. So I'd like to thank a few people who's helped me thus far to where I am in this journey to be a BCBA doctorate. Academic part was done in year 2025. Ooh, man, that was tough. I took a year and a half, 2-year program and finished it in 1 year. At my age, boy, you're talking about miracles. I think they should go ahead and put me in one of the chapters of the biblical books. Also, the next step was to complete 2,000 concentration hours. In the process of doing that, now I'm at, I completed 1,066.49 hours. So I'm over halfway done with that. They require research, BCBA require research in psychology journal. Now, you all know I have research in 2 different journals. I have research in social humanity and I have research in business and economic. But I was told I had to do research again. Oh my God. I said, here we go working this mind again, trying to get research done and put in this journal of psychology. They said, go ahead and put my picture on the front of that journal of psychology. Said, this guy is crazy going through this at his age. But that's one of the last stages. The last stage will be after I complete the 2,000 hours and complete the apprenticeship program that I'm a part of, that I have to pass the board certification test. I'm not too concerned about the test right now because it's not close. Individuals I'd like to thank. First of all, this young lady has been in the world to my development to this point. And to have the patience to deal with an old dog whose whole life has been dealing with marketing and budgeting and the movement of transportation, movement of shipment, storage of shipment, or merchandising, and convert over to mental health. And autism is that. And to have the patience to deal with me and to listen to my concepts, how it does not relate at all to mental health. And listen to it and then convert it and show me how the conversion is done. It helped me understand how it's done. She took me from the very bottom frame and understanding the basic terminology of the RBT, because you started as RBT and then went to apprenticeship training. Now I'm in an apprenticeship training program, but in order to go further to BCBA, I need to understand the basic concepts within the framework so I can understand what things are said, what things are done, and why they said and done, and how to work with the client. So Sydney Chance is her name. I thank you. I would not have gotten to the point I am now without your patience and your understanding. I appreciate your help, and I know I'm not going to get over that hump and over that hurdle into that final stage without you as well. But I just want to thank you so far for everything you've done as far as helping me along. One thing these young generations going to understand is that the baby boomers have no problem at all giving thanks and congratulations to the individuals that help us along the way. It's better than these, especially at this stage of, man. I mean, she had more patience than my kids had with me. Thank you again, Sydney Chance. I appreciate it. The other individual was Brenda Mulgy. She's she overseeing the apprenticeship program that I'm involved with, one of the individual. And anytime I need help, she's there. Call or email. And she'll say, no, put it in the group chat. If you want to communicate with me, I still need to communicate with her directly, and she don't complain. So thank you, Brenda. I appreciate it. Tatiana Lalavolis. I've been beating that name up since I met her, and I think I beat that name up till I leave. Thank you, Tatia. Tatia is an individual who oversees the RBTs, and I came in as the RBT before I went to the apprentice program, and she still connects to me in a way administratively. And whenever I need her or I have a question or anything pertaining to that avenue, she's there. So thank you. It's good to have direct resources versus indirect resources, because that direct resources that connect themselves to me has allowed me to progress very quickly. I think I'm further along than I should be. And the next individual is Taylor Rogers and Samantha Serrano. These are the two, I won't say, these two individuals is the one that took the brunt of my jokes, my criticism, and my pushback in training and developing foundational information within the program. Sydney did the layout and everything. Sydney Chance did the layout and everything, but she had Taylor Rogers, BCBA, and Samantha Samero, RBT, train me, ask me questions. Each individual was different. I mean, training with Taylor was like training with Sydney. And training with Samantha was like training with Hitler. But she made sure I understood it. I mean, oh my God. I was a drill sergeant, RDC, while I was in the military, United States Navy. And I could put up with anything, even plasma fraternity. I put up with anything. But that young lady, I said, oh my God, I can't believe I got the patience. I mean, she from New York too? Oh my God. But thanks to her and Taylor, I end up being right now further along than the average individual. June Nye Hurst. I know I beat that name up. She's RBT. Sierra Jackson. Whenever I feel like aggravating somebody, I look for her and I find her, and she allowed me to do it. I don't know why. Valerie Monroe. She helped me a lot with the academic part. My classes, I had to do these special projects, and I had to do these group projects, and I had to do these last minute interviews, and I just communicate with her. She said, okay. I said, oh crap. I wonder why I got to give her dinner or pay tuition for her firstborn, what I got to do for her to help me out. And she said, okay, no problem. When I need your help, I just want you to be there, because she's going through academic courses now. I said, wow. Elaine Calgila. She helped me a lot when I first got there as far as the ABA Center, and then she integrated and also helped me with the apprentice program before I even got started the apprentice program. And then she also helped me out with a lot of the different terminologies and stuff. So thank you, Elaine. Jessica Diaz, RBT. Elaine and Valerie are both RBTs. And of course, my two, what I call work daughters, Adriana Peterson and Destiny Chisholm. Now, Destiny is a pain in the derriere. Why? Because she reminds me so much of my daughter. Why? Because they both graduate from the same high school, the same class, the same school. Yes, she said she knew Taylor when he was in high school, the same senior class. And Taylor at that time, she didn't really, I thought that being the athlete that she was and how popular she was in the state and in the country, that she didn't communicate that much with people, and she kind of separated herself and didn't communicate. But Destiny said that wasn't the case with Taylor. So me and Taylor got to sit down and talk. Taylor had a wonderful life that I didn't even know about. Her communication skills explains why she's so outgoing, because she was so outgoing back then in high school. So she knows Taylor, her and Adriana, my work daughters. We came into the business together, and every now and then we see each other. They say, it's my work dad, and I let the other workers around know that I'm not paying child support, never paid child support, wouldn't pay child support for the two of them. And last but not least, this is my guy. This is my buddy, Lubin Denoy. I know I beat his last name up, but Lubin is one of the few males that works in the facility. He's definitely the only male that worked directly with me. And Lubin's always there, help me out. Lubin is a member of the Alpha fraternity. I'm a Kappa Alpha Psi, so we both Divine Nine, and we go back and forth and all fun and games with fraternities. And that's my guy. That's my guy, Lubin. If I'm looking just to relax and have some laughter, I would just look out when I'm at the center. I'll look for Lubin. He's just so mellow and cool like that. So those individuals I want to thank to get me to the point where I am right now, and will be there to get me over the hump as well. So I appreciate you. I got nothing but love for you. Thank you. Today I want to talk about PTSD and autism spectrum disorder. I know you guys heard me say continuously that I wanted to go into the area of PTSD through BCBA doctorate, but I don't think a lot of individuals understood what I meant by PTSD. PTSD from the BCBA perspective covers everyone with PTSD. And one of the focus of BCBAs is autism, and PTSD also covers autism. Autism adults are at a significantly higher risk of developing PTSD due to increased vulnerability to trauma, including social bullying, sensory overload, and massing. As I go through and explain this, you hear me kind of overlap, or you hear repeatingness of certain terminologies, because I want you to get the basic concept of what I'm trying to say with PTSD and autism, because probably some of you probably never heard the concept of PTSD even being connected to autism. The areas of breakdown, we're going to talk about social bullying in individuals with autism spectrum disorder. You hear me say ASD. ASD referring to autism spectrum disorder. It refers to the aggressive behavior that involves an observed or perceived power imbalance where a youth or group target another youth or group. Yes, it can happen in autism, just like the regular society. And as you listen to me as I go along, or follow me as I go along, you see or hear, say, wait, that connect beyond autism. That connect beyond autism. Yeah, some does, but it's the reason why you deal specifically with the autism kids with this particular PTSD versus regular PTSD. Sensory overload in autism spectrum disorder, ASD, refers to the brain's inability to process excessive sensory input effectively. This can involve various stimulus such as bright lights, loud noises, crowded environments, or complex information. Somebody's probably saying sensory overload. What is that? What is he talking about? But first, in order to understand what sensory overload is, you need to understand the term sensory in the content of ASD. It refers to how individuals perceive and respond to sensory information, such as sounds, lights, textures, and movements. Sensory processing difference mean that autistic individuals may experience sensory inputs that others barely notice as uncomfortable or even painful, leading to unique sensory needs and responses. And the third one I said was massing. Massing in the content of ASD refers to behavior where an autism individual continuously or consciously or unconsciously hides their natural traits to fit into societal norms or expectations. This can include suppressing emotions, needs, and nonverbal behavior to avoid unwanted attention and feel safer. It is often described as a survival strategy that can lead to exhaustion and burn over time. Trauma systems in autism individuals often present as intensified sensory issues, increased rigid behavior, shutdown, or heightened emotional dysregulations, but conditions share symptoms like avoidance and hyperarousal, making diagnosis complex. Trauma and ASD, high co-occurrence, different types of trauma. Studies suggest that roughly 30% to 60% of autistic adults may experience PTSD, which is significantly higher than the general population. Increased vulnerability. Autistic individuals are more susceptible to PTSD, particularly due to social stressors, bullying, and trauma in social situations. Sensory and massing trauma. Trauma can stem from intense sensory experiences or the long-term psychological impact of masking with conceding autistic traits. PTSD symptoms in autistic adults. While PTSD symptoms often mirror neurotypical experience, flashbacks, avoidance, anxiety, they can manifest uniquely in autistic individuals and other experiences such as behavioral rigidity, increased need for routine and control, sensory sensitivity, greater reaction to sensory stimuli, meltdowns and shutdowns, an increase in these experiences, social withdrawal, further isolation to feel safe. I mean, that individual likes to do everything alone. No social interaction, no physical contact. Just leave alone, be alone. Difference in trauma response. Diagnosed challenges. PTSD and autism can be mistaken for a worsening of autism symptoms, leading to misdiagnosis. Types of trauma. In addition to physical danger, trauma for autism people can include bullying, social rejection, and overwhelming environmental or sensory trauma. Memory processing. Trauma memories may be stored differently, sometimes focusing more on sensory details rather than chronological order. Treatment considerations. Adaptive therapies. Traditional talk therapy may need to be adapted to be more concrete and sensory friendly. Focus on safety. Treatment should prioritize establishing a sense of safety, particularly in social and sensory contexts. Cognitive behavior theory, CBT, often used, but it should be tailored to the individual's cognitive and communicative style. Whenever I'm talking about PTSD, I'm always going to include CBT, cognitive behavior theory. To me personally, there's no PTSD communication training development assistance unless you include cognitive behavior theory, CBT. Here are some key points to consider when customizing CBT for individuals with ASD. 1, comprehensive assessment. Begin with a thorough evaluation to understand the individual's specific challenges, strengths, values, and goals. This helps identify the cognitive distortions, behaviors, and emotional patterns that need to be addressed. Always do assessment. I don't care if it's within mental health or anything. If you're going to be heavily involved with it, or it involve another individual, or it involve connecting to another individual, do your comprehensive assessment. Number one, you want to make sure the individual is taken care of, got to make sure the individual is focused, got to make sure the individual is involved with what you're doing. You got to make sure what you're doing is correct. Because you won't go in and do an assessment on a cat fetching a bone when you know the dog does it. You're not going to go in and do an assessment of a dog scratching a cat pad when you know cat does it. Why is that? Because number one, you're going to already do your comprehensive part of it, and basic knowledge will tell you that that doesn't happen. But who knows? It might happen in certain countries. You can't go in through assumption. You got to do that comprehensive, what I call research. And then you go further from that. Cultural sensitivity. Adapt techniques to align with the individual's culture, spirit, or personal belief. Said the individual's culture, spiritual, or personal beliefs. Do your history on the individual, basically. Don't go in and thinking each individual is the same, because each individual is not the same. And each treatment is going to be different because each individual is different. So don't go in saying, well, this is what I did for client A. Client A might have been 7 feet, 360, 79 years old. And you're trying to use the same method for client D. Client D might be 4'11", 160 pounds, and 47 years old. So that there tells you it's going to be different techniques, different communication. For example, reframing thoughts can incorporate culturally significant narratives or practices. Personalized goal setting. Collaborate with the individual to establish realistic and meaningful goals. Ensure that therapy remains relevant and motivating. I mean, don't deviate from the therapy. Don't go into something other than what you're there for that treatment for. If you're there to treat an ankle from a patient, you're not going to treat his arm. If you do treat his arm and that sucker allow you to do it, something wrong with you and that doggone client. Seriously though, you're not going to do opposite than what you're supposed to do. It's just like a doctor going into surgery to take your heart out and they take the kidney out, then come back and say you're good. No, those are not realistic, personalized goal setting. And the person must be motivated. If you're going through issues, I don't care if it's mental or non-mental, it's going to be less motivating. So you're going to need a motivator. And a lot of time that motivator, that 100% motivator needs to be that spouse, first of all. And because that spouse is the individual that see that spouse day in and day out. Or that 100% motivator need to be that mom or that dad. Both parents, actually. Because that child will see them parents day in and day out. And sometimes you go even further than that, and that motivating individual can be the siblings, the kids. So, because some kids are closer than some parents think they are, especially when they're all being sneaky at the same time. But they trust each other. Some kids trust each other more than they trust their parents. So whoever that motivating stimulus is, you need to make sure that you're present. Flexible interventions. Modify standard CBT techniques to match the individual's preference, preferred way of learning and communicating. Line it up. If they're happy doing it or happy being there doing it, then line it up to make sure that they are. Because that individual might need 6 weeks of treatment, and at 4 weeks or 3.5, they don't want to do it anymore. But if they already aligned it up with them, their thinking, their motivation, and things of that nature, they're enjoying it. So because they're enjoying it, they want to be there. Because they want to be there, they would show up at each meeting. They probably even show up 15, 30 minutes early. But if they don't want to be there, they probably still show up. You might see them 30, 40 minutes later. Match the individual's preferred way of learning and communicating. Addressing comorbidities. If the individual has coexisting issues, techniques should be chosen to target overlapping symptoms. For instance, relaxation training can reduce both physical and emotional distress. Developmental considerations. Adapt techniques based on the individual's age and developmental stage. For example, use storytelling or games for children and focus on existential concerns or life transitions for older adults. By considering these factors that I mentioned, all of the factors that I mentioned, therapists can create a more effective and personalized CBT experience for individuals with ASD, leading to better outcomes and a more satisfying therapeutic journey. Now, it's very important to understand that I will be touching not only the behavioral therapy side, but also a little bit of the autism. But I won't be getting specifically into depth with autism because that's not my area of specialty. It could be if I focus a lot on it, but that takes years to do, especially when you're dealing with kids. And then that's why I mentioned the people that helped me to this point, because they're so smart in their area of expertise, dealing with autism and the kids. I'm not even close. I just sit back in amazement and in awe, like, wow. Asked me to do some research. I think I'll blow all them little suckers out the water. But hands-on, techniques, understanding on the fly for the moment, those individuals are sharp. PTSD is my baby. You're going to hear a lot of that for the remainder of the year. I thank you for 2025. Since it's the first podcast of 2026, I didn't get a chance to do that before. So I'm doing it now. And I appreciate you in 2025. And I will appreciate you in 2026. And before I go off, I'm not going to ask her to say anything, but I'm going to show her because my wife is in the studio. Come here, sweetheart. She's in the studio. I told you I'd get her here. Man, that was almost 5 doggone years. But thank you. I appreciate you. What I forget? What I forget? Subscribe to me. Thank you and goodbye.